Hello and welcome to Unmasking the Trans Movement with John Euler. I'm your host, Brad Wilder. Today, a fantastic guest. John is standing by to bring in Robin Atkins. She is a mental health counselor of 19 years. Robin also has a variety of different settings and people that she's worked with over those 19 years. She's also chair of the subsection of the American Association of the Pro-Life OBGYNs. She's also a molestation and rape survivor and a post-aborted woman. She specializes in mental health for the last 7 years, working with rape survivors and as well rape trauma and pregnancy trauma. She's basically been in the industry of sexual help survivors. And today, we're going to unmask what this trans movement is all about and how mental health professionals around, well, not only America, but around North America are coming together slowly but surely to help put a stop to this trans movement. With that, let's bring in John. Great to see you, John. Thanks a lot for being here today.
Brad, thank you as always. We do have a subject matter expert today. Robin Atkins is, in my estimation, one of the most knowledgeable individuals when it comes to the implications and the repercussions of having medical procedures foisted upon young people and what happens after the fact. So Robin, welcome. I couldn't be more thrilled to have you.
I'm so excited to be here. Thank you so much for having me. It's such an important topic as I watch kind of all of these different areas where I've seen women and children hurt coalesce around this topic. And it's been predicated for years now in these other areas bringing us to this point. And I'm so glad you see that as well. And I'm excited to help your audience understand how that came to be.
Robin, I'd like to cover a couple of topics in part one. And then if you're okay, we're going to need 2 parts to this, and then we'll have you back. So if you're okay staying with us, we'll kind of continue on into part 2 because there's so much for us to cover. The first is the issue of I have multiple concerns. Any decent person, any decent, protective parent has concerns about the trans movement. And what I've said is, first of all, we're not anti any group of people. We are pro protection of women and children. We're all about raising the bar on the protection of kids. That the trans movement, my concern is this, that the trans movement by nature lowers the bar on child protection and causes therapists and others who are mandated reporters, it causes them to begin to reframe red flags of child abuse or grooming or exploitation. So a child will show various signs and symptoms, and we're going to have you speak to that because you also have worked in Children, Youth, or Department of Children and Family Services in Indiana, I believe. So you have extensive background. I'm going to have you describe your background for those that haven't seen it. And you've been on multiple podcasts, especially with the Equal Rights Institute. What a tremendous group. But to not, as a mandated reporter, to not be able to discern what you're seeing places a child at risk and causes you, not the mandated reporter, not to be able to see what's in front of your face. So to think that we have professionals and mandated reporters that are seeing these red flags right in front of their face, red flags of potential, if not actual abuse, sexual abuse. And we reframe it in terms of gender confusion. And so off to the gender medical professional, so-called, we have now really talk about silence of the lambs. As a therapist, as a professional that's worked in, as you call it, reproductive mental health issues, and then as a mother and as a parent, talk about, but especially as a professional, talk about, you can jump in anywhere of those topics, but let's talk about mandated reporting. Describe that. Also describe your background and where can people, let's start from the beginning. How can people access your work?
Okay, so I am in private practice based out of Indiana. My website is www.charis@veritasllc.com. I absolutely love my business name, Charis at Veritas. It does not make great for a great website or email. I wasn't thinking of that when I created it, but it means grace and truth. And that's what I hope to bring to every counseling session and with all my patients. And so it's CHARISETVERITASLLC.com. People can check out my website. It's all about the work I do now. Prior to private practice, I had been working with the government and DCS as a contracted therapist in home-based services with children and families involved with the Department of Children's Services. And I was working both with perpetrators of abuse and the victims of abuse. And about 85% of my cases during that time was child sexual abuse. Prior to that, I was working with homeless women trying to transition back into normal society. Prior to that, I was working with a church on spiritual abuse and those kinds of issues. And prior to that, I was working in addictions. So I've been kind of all over the map in my career, but the last 7 years have been focused on reproductive mental health. And there is a lot of crossover in reproductive mental health and the trans movement. Currently, when I see patients that are dealing with gender dysphoria, it's typically around pregnancy or infertility related issues having to do with if they've had any kind of hormones or surgeries. Is pregnancy option for them or not, or if they are pregnant and experiencing gender dysphoria, what happens in that space. So that's typically when I'm seeing those patients. However, my biggest concern is when I think about the idea of gender affirming therapy. It's such a misnomer because there's nothing skilled or therapeutic about having someone come to your office and you saying, absolutely, you can self-diagnose. And here, let me hand you a letter that allows you access to medical professionals who are going to undo your healthy biology. There's no skill in that. That is not therapy. And so it's such a misnomer to consider. And when I think about what leads a child, especially, to have gender dysphoria, where have they even heard the idea that they may be in the wrong body? Any child under the age of 10 to 12 that's talking sexuality with me, why are they even thinking of sexuality?
Go, right? That's
Yeah.
exactly the message that I've been sharing, right? That left
Mhm.
to themselves, a child prior to puberty is not going to have a sexual thought as we understand sexual thought. That whole thing, children are sexual from birth, that comes from Kinsey, the deviant.
Correct. Out of
You know,
Indiana.
oh
Yes.
gosh, right there. That's
Yeah.
right. University of Indiana, Kinsey
Yeah.
Institute, right? It all
Yeah.
started there, all the
Hmm.
deviants that unleashed all of this. So yeah,
Hmm.
so that should be number one, a warning sign, because what's so powerful is I've seen so many of these detransitioner videos. And what I try to help people see is this: as these poor young adults now are describing their journey of coming out of the trans cult, right, and awakening to their scars, emotional, and talk about adding injury to insult.
Hmm.
That oftentimes you'll hear a young person say, well, I knew I was by the age of 10. And I try to help people understand that's a massive red flag, because a 10-year-old left to themselves without being unduly influenced, we call that grooming, they will not
Hmm.
have a sexual thought. So if somebody in retrospect tells you, you know what, I think by the age of 10, I knew I was bi, what you know for sure is this: somebody was grooming, if not perping on that kid. And the young
Hmm.
person doesn't know it.
Hmm.
Right. It is possible, and you can speak to that as well, Robin. You can have abuse victims that don't know they were abused. They think it's just flattery that this older man is paying attention to them, this 25-year-old, this 30-year-old, this 40-year-old. So they think that it's mutual when they don't realize they're being perped on.
Well, even worse than that is this whole idea around secrecy, which is one of the steps of grooming. A child who is raised even in an environment where they're actively being raped, if it's all around this cloud of secrecy, they do not know that that isn't happening to every other child because they're too afraid to even talk about it. So their assumption is other children are going through this too. This must be normal. And now we have schools stating, absolutely, we'll keep your secrets from your parents. And children are thinking this is normal.
This is a predator's heyday.
Exactly. Exactly. When I think about the movement to make pedophilia a recognized sexual orientation, and then that in conjunction with Oberfell, the Supreme Court case, that means we will have open pedophiles who cannot be refused to being hired as school counselors.
Let me qualify that. People need to understand this is such an important issue. Robin, we're going to need to have you on day in and day out for the next umpteen months, but we'll have you back as oh gosh, this is so powerful in this sense that people need to understand one of the significant concerns. So there are a lot of what I call dark special interests that are feeding off the carcasses of these kids. The trans movement is the world's greatest scam, scheme, and ruse that's being pushed upon vulnerable kids and families to gain access to the private spaces and private parts of vulnerable kids and women. Pedophiles are behind the scenes. They are loving this movement because this is a backdoor. They know they can't directly touch age of consent. Pardon that pun. They can't, it's never going to pass in the legislature. So they do this bodily autonomy. They push this and they push secrets. And little by little, and then they also strip away parental rights. They're going to bring the child, as it were, to themselves, just like a cult does. And the issue of pedophilia is a huge, behind the scenes, this is the ultimate Trojan horse for those that are seeking to add the P. We have Dr. James Cantor out of Canada, who's pushing this. They destigmatize it. There's a stair-step fashion. They destigmatize and then normalize, then eventually legalize, but they know they can't legalize it. They just keep dropping age of consent, but they're going to add it to the alphabet letter LGBTQRST, right? And so suddenly it'll be granted civil rights protection.
Correct. And then when you tie that into what's already been done, and this is where we get Planned Parenthood and abortion connected to all of this, we have judicial bypass for children to obtain abortions without their parental consent. And we know through interviews with attorneys that have used the judicial bypass system that 95% of those children are just afraid of their parents' disappointment. There isn't actual abuse or neglect going on, but they're just afraid of parent disappointment that they've had sex and gotten pregnant. They're getting abortions, and we're calling that bodily autonomy. Well, that sets up the whole parameter around children being able to choose hormones or transition therapy without parental consent. So this has been a process that's been 20, 30 years in the making through Planned Parenthood, who is now, since abortion rights are being restricted throughout the country, and I hesitate to even call them rights because I don't believe the destruction of any human being is a right, but that's what they call it. So since that's being restricted in different places, Planned Parenthood is pivoting now to gender care, and without any therapy or mental health screening at all, giving referrals to adults and children in the states they can access to hormone treatment and transition surgery.
So parents, therefore, are not going to be notified, just as you can have, you're trusting the school, you trust the teacher, you send your kid off to school, and before you know it, they are speaking in terms of pronouns, they're being affirmed. That's a euphemistic term, meaning encouraged. There's no other way around it. Right? If you don't help a child think through decisions, so we're going to talk about informed consent as well, because you're an expert in helping us define that. But before you know it, and parents are awakening to the fact that, wait a second, this school's been doing this, teacher's been doing what with my kid? The parents used to have to worry about kids having an extra change of clothing. You tell your daughters, you encourage them to dress appropriately. And then sometimes they go and they've got different clothing in the locker, and then they change into maybe a skimpier outfit. Okay, that's a concern, right? Because we want to protect modesty. We want to protect,
innocence.
There you go. But now we find out the teachers are helping a kid, in essence, quote unquote, transition, which is really sex change. Helping them onto the moving sidewalk of the trans movement, where it's social transitioning. And then once a kid gets on puberty blockers and the cross-sex hormones. They're going to be sterilized, and then they're going to be dumped out onto a surgeon's gurney. So to think that that's happening, and now the school, because the precedent was set with Planned Parenthood and abortion, that the school personnel can take a child off campus without
Correct.
a parent's, right? They can't give an aspirin without parental permission. You can't pierce ears without parental permission, but you can go and get your child an invasive surgery without parental permission, and now start them on cross-sex hormones or puberty blockers without parental permission.
Correct. And what's really fascinating about this is the Association for School Counselors in the US, part of their, I guess you would say, platform or their policies and procedures is language around when you disclose and not disclose to parents. And you should never disclose if you personally feel there could be any disagreement on the parent's behalf of socially transitioning their child. But school counselors are not licensed to diagnose or treat. So we have professionals who are there to provide guidance for career choices or class choices, or to manage skirmishes that happen on school campuses, trying to use student self-diagnosis and affirm that, and then keep that from the parents, but also simultaneously tell us they're at huge risk for suicide, but we're not going to provide their caregivers who are with them the majority of the time that knowledge. None of this makes sense.
That's why when it doesn't make sense, you know there's something else behind it. I tell parents, I tell others that what's driving this is both really three things. On a very macro, high level, it's those that desire societal change. But then you have those that are using kids for profit and for prey, sexual prey. Because if you, as it were, you touch a kid's sex and sexuality, you unduly influence them. And now you're dumbing down their intuition, their reality testing. If you tell them a boy isn't a boy, a girl isn't a girl, X, 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 Y don't count anymore. Therefore, biology 101 isn't, you can't discern. And gender is fluid. It's not fixed. It is what it is. Now the child is confused and they are ripe to be manipulated.
Yes, and they're being taught that their sympathetic nervous system that naturally reacts to what I'm seeing isn't congruent with what you're telling me. They're being told it's a phobia, rather than, no, that's accurate. You're correct. What you're seeing is not in line with what you're being told. So their sympathetic nervous system they're being trained that that's their enemy.
They talk to us because that's right out of trauma therapy, right? We're talking their intuition. So every person that looks to get over on someone, we call that grooming. We're going to cross boundaries if somebody's a perpetrator, and you've worked with both. It's very systematic on the part of perpetrators. And little by little, I use this term loosely, the job of the perpetrator, there's no job about it, right? But the task, if you're evil, if you're a perpetrator, then what you have to do is in order to cross boundaries, because you have no conscience, the only thing left to inhibit your ability to have direct access to the body parts, the private spaces of this child, is the child's hesitation, the child's own boundaries. And so you're going to, little by little, you're going to convince the child that they need to trust you. They can't trust themselves.
Correct. And not only can they not trust themselves, they can't trust their parents or their caregivers, because they are at risk just by nature of being curious about anything, of being harmed, because words are violence. So if their parents disagree with them about anything, their parents cannot be trusted. And so they're isolated, which is another part of the grooming procedure.
Which is what cults do as well.
Correct.
Right? They start to draw the child to themselves. Okay, where do we start, Robin?
Well, let's talk about informed consent.
There we go.
Okay.
There we go.
So when I talk to parents about informed consent, or children, whoever I'm talking to about informed consent, in my opinion, informed consent must include the name of what's being done, a description of the procedures of what's being done.
Now, are you referencing, do you have to give the actual, or can you kind of give this little like top surgery, or do you think we ought to actually tell the child what a double mastectomy is. Is that what you're referencing?
Both. To begin with, we need to call it what it is. It's a double mastectomy. And so you tell them what it is by medical terminology. You tell them what's involved. You tell them the potential risks and benefits of it. You tell them there are other options for treatment and care and the risks and benefits of those. And then the second part is you go back and you ask, what did you not understand about that? And you put it in lay terms for them in terminology they understand. And so it's both and. You need to give them the accurate terminology, but you also need to make sure they're understanding what that is. So I have no issue with someone saying, what we're doing is double mastectomy. And if they don't know what that terminology is, we are cutting off your breasts. That's layman terms for what that is. It's not top surgery. That's euphemism. We're cutting off your breasts.
Now, would it be reasonable for a professional who is talking to this child, because again, we are dealing with different laws now, Canada, New Zealand, Australia, that have tried to couch this under quote unquote anti-conversion therapy, which is a misnomer, right?
Mm-hmm.
Because cults will try to take possession of your child. And if you try to get your child back out of that, they'll say, you're converting, the parent is converting. Okay. Well, so they captured the language and now it is what it is. So, and what I say is this, there's no therapist that wants to convert anybody. That's not the job of a therapist. The job of a therapist is to help somebody figure out for themselves what they want, what their values are, values clarification, so that they have internal rebar. They understand their own intuition. They understand so that they can move forward toward their own path without being unduly influenced.
Correct.
Is that correct? The role of a
Well,
therapist?
yes. So when I'm talking, a lot of people will assume because I am personally anti-abortion that I'm telling my patients not to get abortions. That's not informed consent in my office. That's not what I do. What I do around abortion is we talk about what it is, how it's done, depending on which procedure they would be considering, who it impacts, so them and their offspring, and the risks and benefits of that, and there are other options other than abortion around that. And I'm not going to use euphemisms. I'm not going to tell them what direction to head, but we're going to be realistic about who all is involved in this decision of yours. What voices are you hearing and how are those impacting you? So we can get at the heart of what does the patient actually want, not just what Robin wants or their mother or their boyfriend or their whomever. What do they actually want for their future? And is if there any other options that they wanted to consider, but they're feeling coerced or pressured in any way into that one? That's informed consent.
In my opinion, if we're dealing with young people, so let me ask about your opinion as well. In my opinion, if I'm dealing with a young person, a young girl, let's say a 13-year-old, 14-year-old, it comes in and tells us, I don't want to be a girl. I wish I was a boy. First of all, I tell anyone that that's a red flag of abuse right there. In fact, address that, Robin. Why would that be an indicator of abuse? And so for a mandated reporter not to follow up, not to ask a follow-up question, that's remiss.
Because in and of ourselves, it is not natural biologically or neurologically to feel you're in the wrong body. So if someone's telling me I feel like I'm in the wrong body, whether it be I feel like I'm fat because they have anorexia, or I feel like I'm the wrong gender, that is not a natural occurring phenomenon that has been fed to them through some kind of messaging, maybe malignantly, maybe passively, and not even maybe, because now it's all over. You turn on any social media and they're getting that messaging. You turn on Netflix, they're getting that message. So, but they've been fed that idea somewhere. In my opinion, girls most often, and I've seen this as a mother as well, feel afraid of their bodies when they have been exposed to pornography or exposed to being sexualized by other people in any kind of way. So being talked about or to in a sexual manner by an adult, or if they feel afraid of their bodies. So even when I think about pro-abortion language around pregnancy is you're risking your life being pregnant, which is a natural biological state for a woman. That in and of itself is coercive and manipulative. So we have young girls petrified of their bodies and confused and want to escape the possibility of death or rape. And so maybe what I need to do is no longer be in a female body. Maybe that's what will protect me. And so I don't think at any point is someone naturally in and of themselves feeling like their body is their enemy.
And also, if a young person, if a child has been or is being sexually abused, they can reason within themselves, if I wasn't who I am.
Correct.
So a girl's being molested. If I wasn't a girl, then this wouldn't be happening to me. And so they come into our office, and we don't know what is prompting that statement, right? Could be that how many kids are hearing it in school now? Could be exactly what you talked about, that the pressure for these girls and the potential of sexual exploitation, or it actually could be happening.
Correct.
Very few kids, Robin, speak to that. And you also are a survivor. We're going to get back to the last piece of mandated reporting, at least for this portion, which is, I believe it is reasonable to assume that if a younger kid, let's say age 13, so we're middle school-ish, high school-ish, actually that'd still be middle school, that they have a hard time comprehending and apprehending. Okay, I'm going to get my, double mastectomy, I'm good. But they may still not be able to comprehend. It is incumbent upon us to ensure full information is delivered. So to show a photograph, a number of photographs of what it looks like is part of doing our responsible job as to ensure informed consent. What are your thoughts about that?
Yeah, I would agree with that. I don't know that I think that that's a good idea on like a mass level, but one-on-one. Yes, I think that's appropriate.
Yeah, I'm not suggesting we suddenly pull down this large screen and say, okay, well, here's, right? But to ensure, so if this child seems like they've made their mind up, just to double check. Okay.
Well, yeah, I want to tie it back into that's the difference between gender affirming care and exploratory therapy, which is what we're all trained to do. Because a person has 7 or 8 areas of health, depending on which wellness wheel you're looking at. And so this piece is touched by all those different areas, and we need to ascertain, is there something else going on? We know that with gender dysphoria, almost 100% of the time, there's comorbidities there. So we need to be addressing the whole.
Define comorbidity.
So other mental health complications or physical complications involved. So we see often eating disorders involved, or some kind of frontal lobe disorder, which could be ADHD or autism or antisocial personality disorder. So something involving their frontal lobe, which is their decision-making, impulse control, executive part of their brain. If they've got another disorder that's impacting that part of their brain, we see that often with gender dysphoria. Well, if you're not able to make executive decisions, how can you possibly understand as a child the ramifications of a decision like forever altering your body and becoming sterilized and never being able to experience sexuality or pleasure?
So if you are, let's say, a financial predator who happens to be under the guise of a physician who is going to be able to make a profit from either the number of visits or also pushing pharmaceuticals, and happens to either do surgery, or if you're a surgeon, we want to believe that medical professionals are acting in the patient's best interest and would never be driven by profit motive. But as we found out from Dr. Gallagher, which is Dr. Yeat the Teats, who apparently has closed up shop and I believe taken her yacht and gone to a foreign country, according to Alex Aaron. So that's very interesting. Where's Walla? Where's Dr. Gallagher? Robin, would you be willing to stay right there?
Yeah,
we are
absolutely.
up against the clock. And we're going to pick up at this point because we have just gotten into the beginning of the issues, dealing with the medicalization of kids. We're going to touch on and deal with the role of Planned Parenthood in this. And then we're also going to touch on, you as a mother recently had an experience with a therapist that you thought was acting in your child's best interest, yet you found that they were serving or acting as an activist.
Correct.
We will pick it up on the other side on part 2.
Okay.
This is Unmasking the Trans Movement with John Mueller. We'll see you next time.